Hi guys, welcome to another episode of Health Geeks podcast. Today we're going to talk about exercise prescription for cancer patients and survivors. I have with me Fernando, our physiotherapist and strength conditioning coach, and we have also built a platform which we want to share with you. Introducing ALLWIN, a platform where you can earn discounts while learning about healthy aging. Simply answer the knowledge questions which you can find on the platform and you'll be good. Try it out for free at allwin.co. With that, let's get started. Eric, my first question is for someone that just learned I've got cancer. Exercise is probably not one of the top of the mind concerns. So why should anyone pay attention to it? And does it help you save your overall healthcare spending? Does it increase your chances of staying alive? How exactly should we prioritize it?
Okay. So first and foremost, if what did you describe is your current situation, we're terribly sorry to hear about it. Being told such a big piece of news is very difficult, and it will probably take you some time before you are mentally or emotionally ready to think about exercise. Luckily, cancer management has improved tremendously over the past 70 years, and overall cancer survival rate in Singapore is about 60%. Let me just give you a bit of information about exercise and its benefits first in cancer survivors. So exercise has been shown to improve functional capacity in anybody. And in cancer, both cancer and its treatment take a lot of physical toll on you and can increase your financial burden as well as increase your disability. So improving your functional capacity before going through any of this treatment, during or even after, will definitely improve your functional capacity, and this does improve your cancer survival rate. In terms of financial burden, being more physically able just means that you would require less adjunct treatment or less additional service such as wheelchair, ambulance services, or home nurses, all of which reduce your overall financial costs.
So I guess it depends a little bit on context, but on the overall, it does help to be able to exercise and to do the exercise. Is that right?
Yes, correct. Exercising, like I said, improves your functional capacity, and the more functional capacity just means how able you are. And the more able you are, the more things you can do, the less you need to rely on people, and that reduces financial burden as well as other costs to you.
So in that case, how exactly should we go about approaching it? Should we prioritize a certain type of exercise, or is it again dependent on context? How do we, on the whole, then approach it?
Yeah, okay, so there's obviously an ideal and there is reality, okay? Ideally, the guidelines would tell you that cancer survivors should exercise at least 5 days a week, at least 3 days of aerobic training of duration of at least 20 minutes, and you want it to be around moderate to vigorous intensity. On top of that, you want at least 2 days of resistance training targeting most major muscle group. And you want to do flexibility and balance training as often as you can. But obviously with cancer survivors or patients, this is not always possible. They have lots of symptoms such as fatigue or pain that might limit their ability to do exercises. So as a start, I think the recommendation recommends that 45 minutes of moderate physical activity level for at least 5 days a week is good enough. And this physical activity level should be above what you are normally doing.
And what's the reason behind this baseline? For example, we understood like 10,000 steps is good for you as a guideline, and then after that there's more explanation to it saying it's an arbitrary number, right? Yeah. Is the guideline for cancer, exercising with cancer, similar in this sense where, these numbers are arbitrary, or like, what is the rationale exactly?
Right, okay. So I think with most guidelines or with most recommendations, the way they get it is always through studies. So they will take like a pool of people, cancer survivors, cancer patient, and they will do like a longitudinal study. And what they will do is they will find the level of physical activity that these people do that corresponds to an increase in physical function, in mental health outcomes, and then they would try to benchmark that and say that this is the level that would give you this benefit. Doing more will usually be better for you because you get more of the benefits. Yeah.
And more, does it mean a specific type of exercise like strength training or aerobic, or again, it depends on what type of cancer you have? And
Okay, so I think the answer to that is yes to everything. So the type of cancer that you have, the severity of cancer that you have will make a difference. But each type of exercise, aerobic and resistance, do confer their own benefits, and it is good for you to. And doing more of each type will just give you different type of benefits. Like for example, doing more aerobic training has been shown to improve muscular endurance and cardiorespiratory fitness. Doing more resistant training has been shown to increase muscle strength. Doing a combined type exercise, doing more of it, has been shown to increase all of what I mentioned before, together with like mental health outcomes such as depression, quality of life, sleep, etc.
And then to get started, we always hear get the doctor's clearance. But then for ourselves, what are some things that we should be wary about, even past the doctor's advice of, yeah, you can go ahead?
Yeah. Okay. So first thing that I want to say to that is a medical clearance is not always necessary, especially if you're doing your exercise at a lower level. But there are certain situations when medical clearance is a must. For example, if you have just gotten the diagnosis and hasn't been started on any treatment, if you have other conditions on top of cancer, such as like chronic kidney disease, cardiac conditions, or if you are done with your treatment, but then you start having new symptoms, new pain, new problems elsewhere, then definitely speak to your oncologist and make sure that physical activity or exercise is something that is suitable for you at this point in time. On top of that, you do want to respect your symptoms as well. If you're feeling super fatigued, like particularly tired that day, it's okay to skip a day. Or if you want to, you can just do some very light physical activity. Some is better than none. Okay. And the last thing, some treatments will put on you'll need to take extra caution with some treatment. For example, if you are on feeding tube, if you're on urinary catheter, stoma bag, if you're on chemo or radiation therapy, if you're on immunosuppressant drugs, these are all things that can increase the risk of you getting an infection. And so you want to be exceptionally careful about exercising in public spaces and make sure that all the shared equipment are sanitized properly before use.
And if I were an exercise professional, I mean I am, yeah, and I were to take a cancer patient, what are the things I should look out for?
Okay, that's a great question. Okay, I think everyone will have their first, and exercising or taking a cancer client is something that you want to do well from the get-go. I think what is very important is your familiarity with the matter, meaning to say that you should know your client well. What type of cancer that your client has, which stage, what's the severity of the symptoms, what symptoms they're having, what are some of the medications that they are taking, and what are some of the side effects. Are the treatments that the person is doing, have they completed treatment? Are they undergoing treatment? Have they not started on treatment? If they're on chemo and radiation therapy, how many sessions have they gone through? What are the side effects that they are experiencing from those treatments? And how many more sessions do they have left? All of these are important information to tell you what to look out for and how you should respond or how you can respond to all of these scenarios while exercising your client.
So if I'm taking a client who is a cancer survivor, how should I change the training, and should I change the training if there's a relapse?
Okay, so in cancer there's remission and active phases, right, which are your relapse. If there is a relapse of cancer, then you're essentially going back to the active phase of cancer. And so the guidelines and what you should be doing will be the same as how you would exercise them the first time they got a cancer. How you would exercise them during remission though is different. Exercising during remission is probably one of the best things that you can do as a survivor and for your client, simply because after a cancer, your physical function will be lower. And that remission is the best time where you are stable and you are safe to push yourself and increase your functional capacity and physical ability to a level to your previous level or even better. And like we mentioned, in cancer, there's always a chance of relapse. Exercising actually also reduces the chance of cancer relapse or recurrence in many different cancer, including like prostate cancer, colorectal cancer. And increasing your functional capacity during this period means that when you have a cancer relapse, your functional capacity is that much higher than before. And if it does drop, you will still maintain better function than the first time around.
Okay, last question. If I just learned I have cancer, should I approach a personal trainer or should I, try things out myself? How advisable are both options, and if it were you, how will you weigh these options?
That's a good question. As someone who just got cancer, I think my default answer to you will be ask your oncologist. But to be fair, exercise has been, like I said, exercise has been shown to be very safe with low risk of adverse effects, be it supervised or unsupervised. However, unless you are clear with what to look out for, it is still advisable for you to find a personal trainer, a physiotherapist, or have some kind of supervised exercise sessions so that you know what to look out for when you're exercising and what are the limits that you can go to, how to adjust your own intensity or volume.
Great, that's great advice. Thanks again for your time. With that, we're going to close this podcast. If you have any questions or if you'd like to find out more information, we actually have more knowledge questions and information on our ALLWIN platform. Please do check it out, or you can always ask and comment in the comment section of this podcast. Till next time, take care.